flip.
Rings should be okay. They've got those little doohickey kind of things that attach to your fingers, to your wrists with the little chain thingies. What do they call those? Is there a special name for those things?
I don't think there's a special name for it.
They're just complicated bracelets. Okay.
We want both joints in this one.
Yes.
So I guess we wouldn't need the whole hand.
So, I mean, you can pull the hand this way to get the more
Let's
elbow.
put this. We'll do it that way. Can we see how much is it? Finger hidden. Is that good even there's so much hand showing?
I would bring her up more this way. And again, see how she's kind of coming down at an angle here? So you might want, is this table all the way up?
I think
Is it
so.
up as high as it goes? It's locked. Sometimes that side doesn't work. Sometimes you have to switch sides.
Like something's working.
It's not working. So is it, does it go down?
I think that's as high as it goes.
Yeah, it might, because we might be all the way up. Okay.
Yeah.
Yeah. So you might need to use again the decube sponge.
No.
Probably
on top. A long
We
weekend.
didn't see that. It's okay.
You have to be really good to do it that way. Like, would you get an image? Yeah.
Yeah.
You're kidding.
No, it would be black, but
No, you'd get an image because it would shoot through the
Just be a lot of
there'll
idea.
be some distortion.
It's just
Making a
you
challenge.
want
Right?
Just rub it
That's-
off. It's
You
Yeah,
okay.
want
I
to
think that
show
would
off
keep
your
stuff.
skills?
Yeah.
You can do
After
it
the
that
first
way.
one.
Like I can do it without even
Yeah.
seeing my IR.
Did you just sweat yours?
At clinical
So it's more
Tuesday.
flat there.
Okay.
Okay, cool.
Yeah. Now, often, if you get these epicondyles nice and in parallel, these ones, your wrist kind of goes off. But what's more important is these. Okay. So don't worry if this is like a little bit. You can't get them both. Like don't keep going like this and then like this and then this and then because you could be there for like ever.
There you go.
So you don't want that. So just what's more important is these ones. Okay. Okay. And why do we do it this way?
So there's not any superimposition.
Right, because if we're like this,
Mm-hmm.
we have the twist over. And I made the mistake with Mark, because he was my first clinical instructor. I was all like, I would get very nervous comping, especially with him. Oh my god. I went to do my forearm, spazzed out. I did it like this, and he was like, "What are you doing?" I'm like, "What do you mean? What am I doing?" And then I was like, "Oh crap!" And so it happens. I ended up just performing that one. I was like, "No, I'm not counting." He's like, "Do you want to count this?" No, I don't want to count this. But okay, so I've never ever since done it the wrong way. But just so you know, like we all make mistakes and like big mistakes. Okay, so that was a pretty big mistake. I felt so stupid. I'd still remember it. Like. All right, so yeah, you want to make sure you do this. Okay. All right, so there you go. Perfect. Now let's move to the lateral. Okay. So you can either do that, which have your patient turn around like that, or you can just keep her in the same position.
And scoot.
Well, you can just stay like this. You can still go like this. Turn this and just turn turn this. Which either way, it doesn't really make a difference as long as you get
As long as you're going the long axis.
right. And make sure again you want now this one. Make sure they drop the shoulder. Okay, you need to have this all in the same plane on these, especially on these laterals, because they're looking at this joint being in a true lateral. And like I said, remember it's if you don't get that true lateral, that true everything in the same plane, it's going to be, you're not going to have that. You kind of always look here to make sure it looks like they're actually. Well, I guess that's fine.
Should I collimate in more? Do we need all that?
Well, you're not centered up here, so bring your, just move the
Oh,
table.
that's way down.
Yeah, can we move it? Is it locked? Yeah,
Whoa.
there we go.
Oh, I didn't realize you were
Okay.
pulling it too.
Right there. Is that more centered now? It's hard to see this
Yeah,
line.
it is now.
It's a little
about
bit.
there,
Well,
yeah.
here it is, right there. You can feel it on there.
So it's still a little
So
bit too
it's
far,
just
but
a
it's
little
okay.
bit, but
It's not like we're using AAC. So.
I mean, this is real. This is pretty close too. That looks good there. Okay. All right, so that looks good. Okay, so those are easy. Those are our, oh no, now we have the elbow. Okay, so you guys, anyone want to switch out to do the elbow?
She did a good job.
Where else you want to go? I mean, I don't care. It's up to you guys. If someone wants to jump in.
Is it my turn to get up?
Is it my
She
turn?
don't want to get up. Just, you can stay there.
Okay.
We don't care which arm we see.
Okay.
Okay, Matt.
So,
Can you read that?
some people like being the patient because you can kind of feel what it feels like and see. I'm sorry. This all right, so we're doing AP elbow. What size cassette do we need for this one?
10 by 12.
Okay.
Alright, so.
Here, I'll take it. You're gonna need it again, aren't you?
Yeah, we'll need it.
All the elbows are 10 by 12. That's good.
Oh, they're all 10 by 12?
All the elbows.
Oh, cool.
Think about
That's
your
good to
part
know.
size, yeah, because I mean,
We just
is there
want this
any
much
reason
right here.
we'd need a bigger one? No. Back in the day, we used to have the
Alright, so
more sizes are 8 by 10 and 8 by 10 would be fine to
No.
do an elbow on.
Turn it back.
So we want AP elbow first.
So does that need to be like that?
Yep.
I know.
There you go.
Thank you. Why did they move together? You would think they would.
Kind of lean in, Stephanie.
This one is the elbows are not easy to do, or I mean, it's not that they're hard. It's just they're harder for the patient. Okay, like you know what you have to do, but it's just harder to get your patients in the position. So it makes it when it's harder for the patients, it's harder for you.
Thank you.
Even though it seems like pretty straightforward, easy. Okay. Now we don't need this much showing. You can come down. Center's here. We're a little bit off. So just move this up. There we go. She's in a good spot, but just move yours up. Yeah, there. Okay. So that's pretty good. Some sides might want you to go a little bit less. Some might. That might be just right, but okay, so that looks good.
The entire elbow, right?
Yeah, we need this entire joint right in here, which is going to be like this area right there. Okay,
Okay, so hold your hand still, and then we're just gonna.
perfect. Good. Now you see how it helps, like to you put your hand there, you control
they
the
don't
whole
move.
thing. Yep. So you don't it doesn't move too much, it doesn't move too little. It moves. You control it. Okay. So it's easy. So if you're like on a DR machine, that is like boom, boom, really easy. You
So
have
you're
to
saying
switch it out.
hold
So-
this part?
Yeah,
Yeah,
hold
hold this
here,
part
or
and
you
then
can even
help her
hold
move her hand.
here.
Okay.
Yeah. just
So we
have
don't
her
want
put
this to. We don't want the humerus to move.
No, it don't have to move at all.
All we're moving
you
is
already
just-
have it centered, right, for your AP.
Right.
So all you just need is that little tweak, so you can.
We're just
boom.
taking her hand from supinating to pronating it.
Yeah, that's all you do.
Right.
Easy.
Lateral.
And just like take a visual look to make sure it looks like it went up. Okay. Most people you don't have to do any more to
So,
them, but
would that be
somebody
like this?
you might have the odd situation. Okay.
And I'm just gonna turn it off.
This one you kind of don't have to worry about turning it because either way, this is more of a square. So Either way is fine.
So good practice.
Yeah, that looks. So try and visually in your head when you're doing these with patients, imagine them without the flesh, okay? So try and look, imagine where her humerus is coming down, and you want to get that nice, perfect 90-degree angle here, okay? So always, now, you know, why I say that is because flesh will throw you off, okay? So just try and imagine, because you can kind of visually see, all right, this is where her joint is, so her humerus is going to be coming right down this way, okay? And you can see right into the joint, and then just make sure that this one too, you know, you need that perfect 90 degrees, okay? So just always kind of do, you know, look over top and visualize that, okay? Does that make sense? Does that help you? It'll help you when you get like a person, you know, that with a huge arm, a really big arm. It doesn't, I mean, doesn't need to be fat, but just a big arm, you know? Muscular arms,
Like those
you know, whatever.
bodybuilders who like fit an entire person on their arm.
Oh my gosh.
Okay. So just always like, you know,
Haven't seen any
look
of
at,
those yet.
think of where their bones are. Look
No.
where, visualize their bones, because that's what we're taking pictures of. Okay, in the joint space. That's our concern. All right, good, very good.
Honors?
Good job,
So you
Lucian.
guys are doing great.
You want to do this one on the wall, Bookie?
We're doing them all.
Yeah,
I'll
next
go that one,
one.
see where.
Yeah, now we're moving to humerus, shoulder, clavicle.
Good lord.
It's okay.
Let's all get head injuries because we're not doing head yet. Next, next semester. Okay. Do you want me to do it?
Yeah, you can do it.
Stephanie's about to be real patient, yeah?
She's like, okay, so now we have to make sure that we come off tabletop into the wall, Bucky. Good.
That would help.
Yeah.
I would.
It's just, you know, you can't see.
No.
I know, right?
I'm stuck in
All you ladies in your jingling.
Oh, I know.
Alright. Who's my patient?
Fallon.
Who wants to do this one?
Okay.
Which one are we doing? These guys.
Humorous.
Humorous.
We want to learn it. That's why we want to watch it. We really don't want to.
If you get tired, I'll swap out.
We're up there. We can't see what you're doing.
Alright, which one do you want to do?
What's this one?
Just a little bit.
Is she rotated any? Or no? Yeah.
There you go. You're gonna have to kind of, I don't want to say play with your patients, but that just sounds bad. But kind of like this, because remember we want this to be straight. Her arm, remember, looking at her arm. If we go like this, see how if you're coming
pulls
in,
it out.
it just brings it on an angle backward, so it just could have some distortion. So you want right like that, okay? Now see how it isn't as easy as it seems. All right, why are we not going up? There we go. All right, first of all, make sure you line up your Bucky. All right, but now, do you think we have the whole shoulder joint there?
No.
No. Okay. You have it now. Maybe come up. Okay. So make sure you're getting that whole shoulder joint, and we can see that her elbow is going to be on here. Okay. So that looks good. But again, right here. Now the part where I was saying we can turn the box, and make sure you turn it longwise instead of. Oh my gosh, I'm so sorry. Oh no, I'm all messed up. Sorry. Okay, so now you see how we're like, we have the light going. Actually, I probably did it a little bit too much. But when you do that, make sure that we don't like clip the shoulder.
It's gonna be a fun video.
Okay, and now we can collimate a little bit more in. So we don't have so much light coming across their chest, okay? Now this is why, like, sometimes, you know, doing that straight on is not always, you know, if you want to try and get your body, like I like to have my patient come this way so that I can get as little bit of light on their chest area as possible, all right? Because why radiate your breast tissue, you know, especially if we got females, if we don't have to, you know, okay? But again, make sure you don't collimate too close here, like, see, this is where it gets tricky with these humeruses. Like I said, it seems like it'd be, oh, so easy. But now it's like you're going to look at this going, oh, do I have the whole joint or do I not? So, like, you can just come up a little bit, bring the light up a little, bring this up a little bit. Okay. So now I look like, now I'm happy. Now I look like I got my whole joint up here. I got the elbow joint here. That looks good. And then you just put your marker in wherever you can fit it in on here. This is nice and tightly collimated. This is really good. It looks good. Okay. All right. We don't have a marker, but you know, let's pretend we have a marker right there. Do we have a blue? Is that the right? Is that red?
No.
Okay. Good. Okay. All right. Good. Yay. All right. So then you technically shouldn't have to do a whole lot to go to the lateral. All right. You might want to just do a little bit of tweaking. Shouldn't have to do a whole lot different because you got like the basics there when you have the to go from AP to lateral. Okay. Now see how that feels easier to hold than if you're like that, because what that does is A, it hurts a little more. B, you got that angle on the arm, so this kind of keeps you in a nice straight. Just make sure you get it low enough so like see how like up there we're off of it, so just come like. Doesn't have to be all the way up here, you know, just like that, okay? Just enough to get those epicondyles so they're going perpendicular into there, okay?
Is that enough? In the elbow?
And we still keep both joints, right?
Yes, you're supposed to always get both joints on these. Now, if you happen to have, okay, you can relax. Like if you're doing a shoulder and the humerus, then you might not have to worry as much about the top because you know you're going to be doing it anyway because you're going to do a separate shoulder exam. You know, in that case, make sure you get that elbow. Like, I mean, you want to get them both, but like, you know, if you're going to be doing the 2 exams, and you don't have to worry as much about the shoulder. Okay. All right. Any questions on that one? Okay, just be really careful when you're doing it, and this one really, you should practice this one because it's so easy to cut off one of the joints or the other, okay?
It's a bit late now.
Oh yeah, and make sure you are shielding. Yes, we don't want to forget that. So,
Nice save.
yeah, okay? But that's all, this is where you have it. Now, you might want, if yours raises, this one doesn't look like it raises anymore.
It does. It just
Where's
it's
the-
difficult.
It's got a little like
Oh, it's got a
bobble.
bobble. It looks like it's not very easy to raise. So. All right, so we'll just.
Oh,
there
okay.
you go.
Well, it doesn't
See, it's
stay.
not staying.
Yeah, just it doesn't work.
Okay. All right. So next we have. Now we're moving to shoulders. Everyone okay with humerus? Okay, you got it. Okay. So.
I was like, what was that? No worries.
So we're gonna do the hate there.
Hate's a very strong word.
This is, I know it is, and I try not to use it. But these are just like
Those are annoying.
They're pain in the rear end.
so stupid. Right, all right. That doesn't feel right. Okay.
It's finicky.
This is
Shoulders are kind of, Sorry, you're fine. You can kind of do them almost either way. Just however, if like your site wants you to do them lengthwise, if they want to do it crosswise. You know, kind of. I usually do it crosswise. I think, does the book say lengthwise?
That's crosswise.
Crosswise. Okay, good. Yeah, we'll do it crosswise. I like doing it crosswise because then that way, what, you can get a little bit more of the clavicle.
Yeah. The picture is left.
Names reach.
It's like so hard to read these too.
That's how I feel about portrait and landscape. There's more topical. They have cost in that version.
Okay. All right. So shoulders. All right. So we're looking. We kind of want, you can like kind of see where the armpit line is. So we're just going to kind of go like between here and here, right in there. Okay. It's just, again, visualize top of the humerus. Okay. You can kind of see it, right? I mean, that's the way I just look at people that way now. It's like weird, but kind of just picture the nice ball of the humerus, and you're going to go right to the inside of it, okay?
Kind of like a divot there anyway.
Yeah, there's usually, I mean, it's
Like if you bring their shoulder forward, there's like a hole right underneath the
Yeah.
clavicle.
exactly, okay? So just visualize that, and you want to get the CR right kind of inside that, where that joint is, the inside of the joint, okay? So that's all you got to do is aim there, okay? Line your bucky up. Now again, depending on what your site, you know, what they like, if they want you to have one of your shoulder pictures have the entire clavicle, then most people do it on the AP, I guess, external. Either, it doesn't matter. I mean, either one of them. Just if you have to get all of it in, just get all of it in on one of them, and then the other one you know, you don't need to. Okay. So we're gonna start. Like I start with the internal, like I said, because I like kind of getting a feel for what my patient's pain tolerance is, what they can do. This way they can still support it. Always have them turn their head that way, so you're not, you know, you don't have to radiate their chin or their face. You definitely do not want to have a shoulder picture with a chin in it. Okay, your marker, throw your marker right up there. Easy, right? Okay, so then for external, you just have them, like for me, I turn, oops, sorry, you're fine. I bring this out to the side and just let them rest it on there. Right, like that.
Does
Okay.
make it easier.
Yeah.
All right. You get that?
Does it matter that your
You might wanna
your
bring-
center ray changed?
Not
It's
really.
no longer on your where it was before for the internal.
Actually, let's bring this. Ah! The wrong one. Oops! Don't hit that last one. Okay. Bring this down. This is moving down a little bit. Okay, let's come in here. And let's say our last one was the one where we got more. That's more of like what we want. Got the whole joint there. We don't have like so much going across here. Okay. Now remember, we don't need to get like, don't get caught up like on super like, oh, this one's a little bit different than that one. I mean, yeah, we moved the arm, but really, look here. See, this is really not changing. Our CR didn't change. That. All right. Did it move?
Well, from the last one, we had it centered
the
a little
last
bit.
Yeah, a little bit
over
higher.
here.
I think it was a
But
little bit
yeah,
higher.
so kind of like right here is sort of perfect right there. All right. Now again, if you need to get a little bit more clavicle in, then you would center over a little bit more. Okay. Because we don't need to, like, if we're doing that, you know, we would want to come this way. All right.
See, that makes more sense to me right there.
Right, but see, we don't need, if we're just doing the shoulder
Yeah, but
joint, we don't
collimate,
need.
right?
Hmm?
She's talking about collimating and
Yeah.
so we.
Well, but if you collimate in, you don't want to collimate
I
off
see what you're
the
saying.
shoulder, okay? The joint on this side. All right. Remember, this is our primary objective right here. Okay.
Okay.
When we do the clavicle, yeah, you're going to go right over here. Okay. But remember, the primary purpose of this one is to look at that shoulder joint. So we don't need to be over as much. Remember, your shoulder is like, you know, here's your shoulder. The armpit kind of goes sort of into the middle of it. Okay, the edge. Okay. Now, as you know, if you're you know, centimeter or two either way, as long as you have the whole joint in there, is it going to make a difference? No. Okay. All right. Makes sense? So we did internal, external. We'll do the clavicle right now, and then because we're in the same position, then I'll switch to that wide view. Okay. All right. So let's do clavicle. Are you okay doing the clavicle? You kind of would. Anyone wants one?
Still cross the lines.
Okay. We are still in here crosswise. There we go. Are we? Yep. Crosswise.
For the clavicle, we'd want to lift it more so this could be higher, right?
So mid-clavicle.
Well, we want to see, yeah, here's her clavicle. Okay, good.
Just gonna move.
Okay.
Good.
That needs to be like right there.
Okay, so you make sure generally you can, good. Good, don't cut off this side, but I think you're good because we're over here, so that's where the end of the light is. Very good. Now the only problem here, you probably don't need to be as far over there, but that's not, I mean, that's okay. It's not bad. You just got to give yourself room to put your marker in here.
Yeah.
Okay.
Couldn't you technically put it right there though? Since it's not on the other clavicle?
No, because what are you gonna do? You're gonna put a
Yeah,
left
you're
over there, and we're doing the right
Yeah.
clavicle. Does that make sense? No. You're gonna mark it up here. So you might want to give yourself a little bit more like that, and then just stick it right here, right along here. Okay. This part here is gonna be flush. So if you're in a little bit in there, it's okay. Okay. All right. Okay, so now to switch to axial.
Oh, that's me, sorry.
Avon calling. All right, now when you go down, drop it down low. So when you bring it up, like you don't blind your patient.
How much are we bringing it down?
Well, just drop your tube down, then you can bring it back up. But when you put your angle on, because we're gonna do generally, you know, plan on doing 20. Because what is it? It's between 15 and 30. You know, average patient like 20. Okay.
But how do we know how much to drop the tube down before we angle it? That's
You're
what
just
saying,
dropping
right?
You're
down
just
to get the
dropping
light
it
out
so
of the
you're
face.
not like
Oh,
you're
blinding
not
your patient.
blinding your patient. It's just kind of just so you don't
Okay, I got
blind
you.
them when you put the light on, and then you bring it up. So drop it down a pretty good amount. So
Okay.
Yeah, I had to
rather
drop it
have
down
them-
like right here before I hit her in the face.
So
Yeah.
drop it, angle it, and then bring it back to the center. The
Yes.
mid.
Okay. And then make sure, like, see how this is the light if you just went to here? Okay, go right to there for right now. Okay. All right. So are we centered here?
Oh.
No. Okay. That's why you always center to here. Okay. When you angle, always pull this out. Or you can look on here. See how there's a little line, the lines on here too? All right, so if you don't, you know, you don't have to pull it out as long as you just check it to here. So you can see your center, it's up about.
Since the front of the board is further away than that.
That's correct. That's why that happens. Now, when you don't angle, you don't have an issue because it's just going straight through. It's still the same. The problem is when we angle. And the steeper the angle, like put a little bit more of an angle on it, just for fun.
Fun. 120.
this is gonna even be a bigger difference.
Drop this down. It's not fine. It's gonna blind you.
I see. Forward. Okay. Now it's an even bigger difference. Okay. So the steeper the angle, the more. And you can also see like what angle do you have on this?
It's 120.
So that's a 30-degree angle. Okay, so pretend we have like a guy who this is where their shoulder is. Okay. So we're gonna bring, well no, all right. Bring this line up to here. Like that's not even that tall. Let's go up to here, like a tall guy, right? Now we gotta go. See how we're starting to run out of board?
If somebody is this tall, there's a problem.
Somebody, well, I guess you could do that. But see, that would be like kind of rough doing it. So, but there are like
I had a
we
tall
get
guy
like
recently,
6'10" guys come in and like.
Do you need like a step stool to like fix the thing? I mean,
have
really?
them sit down.
Yeah, you could have them sit down.
I had to do that with a wrist that I was doing. I was like, I'm just gonna have you sit down so I can read.
Yeah, you can. Oh yeah, if they're because
Because like they like to use the bucky for the wrist and the hands. So I had to like reach up here, and the tech's like just have them sit down.
Aw.
Yeah. Sometimes we forget that. Like it's like a simple thing. Like, oh yeah, I can have them sit down. Okay. All right. So we got the clavicle. All right. So now we are going to do the.
Wait.
Do we wanna
Can
take
fix her
some
back
of
so we can see what she's supposed to look like?
Oh, okay.
For the axial.
Okay. Let's fix her back. All right.
So drop it down, angle it up, and then bring it up.
To the iron.
I think I can remember that.
Okay. Now the other thing is too, because we now have that angle, it's going to widen this up, so you can just again
We have
just
to line up the
collimate
bucky
to. Yep.
So for the, okay, so we have to move the
Okay, so
bucket.
this is going to look off, but is it off?
No.
No,
With
we're
the
right
iron
there.
now.
Perfect.
Okay.
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 All right. But let's make sure we get her on here, because you're like way wider than 10 by 12 right now. Okay. Because here's your 10 by 12 line, right? Isn't this in the 10 by 12 line?
Is that 8 by 10? No, that's so much.
Well, but this is, okay, we're here, we're on this one,
I should
right?
get an 8.
Yeah.
Okay.
Well, if you think about it, this
8 by 10.
that's the 8 by 10 because this is the 14 by 17. That's,
So the next one is the 10 by 12.
There used to be a 14 by 11 cassette, so I think.
Oh gosh.
I think it's this one here.
So what's the-
hold on, let's grab another 10 by 12.
All right, now here it is. You're right. Here it is. 10 by 2, because that's 8 by 10. That's real tiny. 8 by 10. So this is 10 by 12. Okay, so we are right there. So you can bring her right here. That's really tight combination. That's good. Okay, just again, remember, leave yourself a little room to put that marker in. Are we gonna mark over here? Okay. Okay. Everybody happy?
Yes.
These are pretty easy. So you feel like, let's do this right away so I can go comp these, right? They're- well, certain ones are like so much easier to do than other ones. And- so now we are going to do the famous Y.
That was so funny.
Why is lengthwise?
Oy, oy, oy.
It's easy to remember lengthwise the Y
Okay,
shape.
so actually since we're in this position here, we'll just do that grashi real quick. Okay. All right, so let's bring this up to her.
Oh,
Remember the grashi, does a lot of you have to do a grashi, right? Okay.
Somebody wanna?
Okay, we'll come back and hold the phone, and I'll do it again.
I got you. I'll do it. I got you.
Oh, whatever. You want?
just make sure you got it in the image. It's good. Okay, so 45 degrees.
The Grashy is 35 to 45. Okay, so that looks, she looks pretty good right there. Okay, so remember you're looking. Actually, we're looking at the ball of the joint, right? Okay, that's where we're trying to get that glenoid cavity. So when you're doing your angle, just kind of remember again, picture like bones, like the center here. So this is what we're making the angle with.
She even looks oblique. So.
Okay, yeah, she's in the perfect position. Actually. Okay, center. Okay, here's the center right here. Just kind of get that right behind there. Okay. So then line this up to here. Line your board up. Mm-hmm. Okay.
So we're able to the patient
Mm-hmm. Okay.
Let there be light.
And we want a nice tight collimation,
chin.
right? Or, yes, we definitely don't want
No chin
chin.
collimation.
A lot. You can collimate a lot more than that.
Okay, I mean, we just can't really come in more without cutting off the shoulder.
You go right there. Move her back.
How do we get that perfect
Should we-
angle though?
Should we drop
Mm.
this?
How do we know
You
we're
can
at
come down a little
45?
bit more. How do you know?
Yeah.
Because you got to know what your angles look like. You got to know. I mean, you know, like if this is 90 degrees, this is
Half of it
45
is,
degrees. Okay, so that's what I was saying. You're kind of looking at the body, kind of go like in the middle of the, the width of their shoulder, right? Picturing that joint, and it may have it make a 45-degree angle to here, right? Don't go from back here, you go from here, okay? Because this is where the joint is, all right? Okay, here's your Grashy. Probably feel like this is even still a little bit too much. Okay, I like that better. Like you try and always get as little of the patient's, especially on females, okay? And then we just mark it right up in there, okay? All right, so that's your Grashy. Okay, so now we're gonna do our Y. So again, for the Y, we don't need, I like to kind of, if you can, if you're able to, sort of set your light ahead of time.
So set it to the 10 by 12.
Yeah. You're not going to need a whole 10 by 12 because is that little Y piece 10 by 12? No, it's not going to be that much. Okay, so we're going to face remember our patient is PA. We're going to angle them, 45 to 60? Okay. But what's really going to drive it is you're going to be looking at this joint and the top of the scapula in here. You're going to kind of feel for it, and what you want is to draw a line from your, like I always do these two fingers, okay? Draw a line from your thumb to that middle finger, and is it making a straight line?
Wouldn't you want her to throw her arm back though at this point? So
Her arm is here, okay? That's not going to really change this part. All that is going to do is get the humerus out of the way.
would you want
Okay.
it to like? Because then when you throw your arm behind your back, it brings your scapula up a little bit.
Remember, you have a patient that's kind of hurting, so doing that may or may not be possible. All right, if they can do it, great. If they can't, this is fine, okay? If you can have them do it, but see, it's not changing it a whole lot. That'll help you with, kind of want to come down a little bit. But where this is important is kind of you got to get that line right, because otherwise you're not going to have that nice wide view. You're not going to be lateral, okay? And everybody's is a little bit different.
Where are you putting your thumb?
Right at the, well, come over here and look.
Are you putting it at the top of the scapula or?
Top, you're putting it at, you gotta kind of feel where the scapula, yeah, the superior angle.
I can
Okay.
see it sticking out.
You can see
Okay,
it
so right
sticking
there.
out, right? So so you can, the reason why you kind of can do this is because that helps you if you put your finger here and you look at them. Okay, yeah, that looks like I got a perpendicular line going into the board. Okay, if it looks like it's, you know, out a little bit, then just tweak your patient's body so that they're rotating so that you got that nice line going straight through it. And then you're going to kind of bring your, so once you got the position right, then you're just going to drop your, you know, your CR to kind of where that point is that sticks out a little bit. Okay,
Like the middle
On your-
of the
it's kind of the middle, yeah, it's right,
that scapula.
yeah. Mhm.
Arms to the rest.
Okay, and put your marker right up here.
So in the pictures on the slides, it showed it like a little bit more collimated, and then this line was like right on the scapula.
Well,
Is that
again,
right?
that depends on your patient. Some patients, you know, if you don't need as much of a an angle,
At the point that sticks out.
Right there where it's at
then
now,
you
right?
then you would then
Okay.
it would be like that. For me, that to me now I don't feel like she's, you know, that line is going perpendicular in there. So for that's why it's 45 to 60. All right, so everybody is going to the more of an angle, the more this is going to move over to the side. If we're getting closer to that 45 degrees, it's going to be right there. Okay, you see how that line is moving a little bit. The steeper, the more you bring your patient away. Okay. So really, so that is just going to be driven by your patient and you getting that perpendicular line. Okay. So don't worry about this so much. Like it's not going to be the same on everybody. Okay. Some patients are going to need 45. Some you might need to do 60 to get this straight line here. Okay. So what you're looking for is up here to make sure that's nice and straight.
The scapula to be straight.
Well, it's not.
You're getting that.
We're talking about this. It's kind of like it's hard to describe. You're going from this point up here, like the acromion up here, and the top of the border of the scapula. Okay, the superior angle they call it. And you want those 2 points. There's a point here, a point here. Okay, you want to connect those points and have it be a straight line into your, or perpendicular line into your IR. Now for some people, you know, that might look more like this. They're more like that, and that's where you get that perpendicular line going in there. It's just got, this is one of those ones that's a little tricky until you, yeah, until you do a couple of them and you see the differences, then you'll start understanding. But that's why this one's a harder one to do, because it's more driven by like your patients, and you know, we can't say, you know, do this, do that exactly. It's going to be a little bit different every time you do it. Okay, but you know, we're going to want it to look the same every time you do it, which, you know, that's going to be. This is not a super easy one to do. All right, it's going to take this one. You guys should need to practice. All right, but you know, the basics are still the basics. All right, you're still trying to get, you know, the shoulder, that wide joint. You want to get your humerus away. If you do this or do this, you know, I don't care so much, just as long as, you know, it's a little bit away from here. A lot of patients, like, which one is more comfortable for you?
The other way.
This way is more comfortable? Okay. So then do that. If that's more, if their patient says that's more comfortable and they can hold that, great, because that does help that scapula to stick out more. Okay, and it makes it, the more you can see the parts without having to touch them, the easier it is for you guys. So that's awesome if your patient can do that. It's more comfortable, yay. Okay, but see, this is where you're trying to get that border. You want it to be perpendicular, that nice Y. Okay. All right, so this one you're gonna have to do this one. It's like no, you just have to practice it. Okay.
And then what about the collimation? Like that's good or?
Well, for her, I would do her more like this. Let's bring it over a little bit. Yep, no, I wouldn't go any more top to bottom, okay? So even for you guys, just so you feel comfortable, leave it open, okay, for now, you know, until you get a little more comfortable. Side to, I keep hitting the wrong one. You can come a little more side to side. Like, is it gonna be over here? No, it's gonna be right here, right? So we can come in like this, okay? And then just, you know, this is an easy one to put your marker up there. Okay. And when you get better, you know, more comfortable with them, you might start coming in a little bit more. You can bring it over this way. Yeah, a little more. Okay. All right. Okay. So this one, again, you're just going to have to just practice it. Okay. Once you get it though. Okay, that's the thing with this one. All of a sudden it will be, oh, I see, and it'll make sense, and then you'll be fine. Okay, so it's just a matter of getting to that, okay, I got it. I understand the concept. Okay? All right, you're good.